gonna start off by verbalizing that we have the proper PPE. And we're gonna get into the nature of illness. Well, before that, make sure the scene is safe. Then the nature of the illness could be shortness of breath, and then the number of patients would just be one. And no additional EMS is going to be necessary, and no stabilization of the spine is also going to be necessary. The general impression of the patient is that he is short of breath, having trouble breathing, kind of in a panic state. Maybe could be nervous from this condition he's having. So from then we're gonna check his responsiveness. He is responsive just because he's able to answer any questions we have for him. He's also is conscious, because of the fact that he can answer and accurately answer all the questions we ask him. After that, we're gonna get into the airway. The airway is open, judging this because of the conversation we've been having with this patient. There's adequate ventilation, and we are going to administer oxygen to this patient on a non-rebreather at 10 liters per minute, just to help him get some more oxygen in his blood. His pulse oximeter shows a good oxygen count. Well, we could say it's low. We could say it's a 92. So we are going to give him oxygen and try to bring that up. After that, we're going to get into the circulation. There's no major bleeding coming from this patient. His pulse is fine. So, yeah, pulse is fine. Circulation's fine. No bleeding. There's pulse is fine. And then the skin also seems fine. It's pink, warm. It's not sweaty or anything. It's just normal skin. So, yeah. That's all good. And then judging from this, we're just gonna treat him, or we'll just transport him just to get him to the ER, just because he is having trouble breathing, and yeah, that could be bad with no oxygen. So after that, we're gonna go on to the OPQ-RST. We could simply ask like an onset, what provoked this? Does it radiate anywhere? How severe is it? What time did it start? So from this, we could say, how long ago did this start happening to you? You could say 30 minutes. And then maybe, did you do anything that could provoke this? The patient says no. He was sitting down, watching TV, and just had trouble breathing. So then from here, we're gonna go on to the sample. So the symptoms, to what he's feeling, short of breath, can't catch his breath. Any allergies? No allergies. Medication, he does have an inhaler. Past medical history, he could say, oh, I had an asthma attack 1 year ago. Okay, that's good to know right now. Last oral intake, had water a few hours ago. And then events leading up to this, no events in particular. That could have sparked this issue with breathing. Then we're gonna examine. After this, we're gonna examine his affected system, which would be the pulmonary system. Maybe oscillate the chest. So cardiovascular and pulmonary systems, oscillate the chest to make sure the breathing sounds fine internally. Make sure both lungs are intact and functioning. And then after this, we're gonna get into blood pressure, pulse, and respiratory rate. You can say blood pressure is normal, pulse is normal, and respiratory rate is also normal. The field impression of the patient, we can maybe say that his oxygen went from 92 or whatever I said up to like 96, 95. So the oxygen did help bring his oxygen level up. And then we would then help him administer his own, we'd help him administer his inhaler to help him calm his breathing down, and help maybe he was having an asthma attack just because he did have one 1 year ago. So now he could be this could be the solution that he needed to bring his oxygen back up. Then I would reassess every 5 minutes, just because he is short of breath and having trouble breathing, and once the body has no oxygen, it's pretty much done. So yeah, and then give the report to the EMS. We have adult male. He's short of breath. No events leading prior to this. He was not in shock. We administered oxygen, and we administered his inhaler, and his pulse ox count did increase, and his breathing rate also increased. His breathing eased, was less labored, so it looks like he was just having a minor asthma attack.